Welcome to the latest Voluntary Health Scotland podcast episode, where we talk to Neil, who speaks about his experience of using a link worker and the impact it's had on his life and health.
Could you tell me your name and a bit about how you became referred to a link worker?
I'm Neil Gorski, and I had to stop working on medical grounds at the time. And I'd phoned my practice to see if I could get a food parcel or something like that. And I was put in touch with Liam, and that was just the beginning of a great journey, I would say, going forward.
Great, and I'm really sorry to hear about the difficulties that you had, particularly with your health. But what was it like working with Liam, and what did he do to help support you?
There wasn't anything that Liam wouldn't do, obviously, within the confines of the law. He was absolutely brilliant. Being diagnosed with a tumor, being off work, not providing for my family, my mental health wasn't great. The spectrum that he covers, there's nothing really that he can't help with. Other, he's not a GP, so he's not giving me medical advice as a GP, but any kind of help that I've spoken about or asked for, he's been able to help. Or again, like I've said before, is been able to signpost. Just what a caring soul. That's what he's been. It's just a caring soul.
What about in terms of the practical support that he provided for you, Neil? Can you talk a little bit about that?
Absolutely. Practical stuff. We worked hard. I personally worked hard on looking for a new job, because it's been a long time through rehabilitation, hydrotherapy, and the likes, just to get mobile again. So looking for a job, and because I haven't worked in a while, the computer side of things I was really anxious about. And although working in critical care for over 15 years, I know my way around a computer, but from not being on one for ages, I was really anxious. So he was able to put in place people that I was able to go and sit with, and they were able to help, with my computer literacy, or the lack of.
So what would you say was the best thing about using the link worker service then, and obviously Liam's support?
It's non-judgmental. He's a human being, just sitting, listening to what's going on, and just piecing together, what he can do. And if there's things that he couldn't do, he would have me signposted to, whatever organization, or person that I would need to speak to or see. So yeah, the doors that he opened for me, that I would never have known about before, he was able to help there. So yeah, instrumental, in not just being who he is, but he's an integral part of my journey in getting better and back to work, which I am now. And he's played a massive part, in that, so he's not just someone that's helped with a food, forgetting my words here, a food bank. a couple of meals here and there. He's helped with a lot of things, and just even somebody to be able to speak to. You know, sometimes it's not even about looking for a result or the cure to. It's just having somebody to speak to. And he was there. He was always there, and still is.
That's great. It sounds like that was really important to you, to have that time and space with Liam and have someone that was there to listen to you and be able to then help support you through that journey.
Absolutely.
That's great. And how are things for you now, Neil? You've mentioned that you're back in work. So how's life for you?
Life is so much better. There was a point in the beginning of our first interactions between Liam and myself, and things weren't great between myself and my good lady, simply because of where I was, and a lot of responsibility was put on my good lady, and things weren't working out too great. And I can say that that is not the case today. That's totally, we've done a U-turn there, and we are, we're loving life at the moment. It's good. Mental health is a lot better, contributing towards my family, and just being who I've wanted to be for, that I haven't been for a long time, is what I'm trying to get to.
Oh, that's fantastic. I'm really pleased to hear that. And just my final question, Neil, if you could pick 3 words to describe your experience with Liam, what would they be?
I think we talk about patient-centered care within the care setting. And if I was to choose 3 words, I would say patient care personified, because that's exactly what I've received and still receive from Liam. He's a lot of time for that young man.
I think we all need a Liam in our life.
Yeah.
Definitely. Thanks very much, Neil. That's fantastic.
Thank you very much.
Thanks for listening. For more information on Voluntary Health Scotland, please visit our website, vhsscotland.org.uk.